Hi everyone, I'm Dr. Olga Nishkumai, and as always, I'm joined by Dr. Vladimir Chernych.
We welcome you to this European Wellness Health series, where we dive deep into the world of medicine, diseases, and disorders, exploring the latest in their prevention, cutting-edge treatments, and
groundbreaking research in biological regenerative medicine to help you stay informed and healthy. Today, we are going to discuss an important topic in metabolic health, type 2 diabetes mellitus.
Yes, diabetes is a global health challenge that affects millions of people worldwide. It's a chronic condition characterized by the insulin resistance, which, if not managed properly, can lead to serious complications. Dr. Olga, could you start by explaining what exactly type 2 diabetes is?
Certainly, type 2 diabetes mellitus, often referred to simply as diabetes, is a condition where the body becomes resistant to the effects of insulin, a hormone that regulates blood sugar levels. This resistance often develops with obesity and is associated with metabolic syndrome. Then, over time, the pancreas cannot produce enough insulin to compensate for this decreased effectiveness, leading to relative insulin deficiency. Like first type, type 2 diabetes mellitus has a genetic component with a family history significantly increasing the likelihood of developing the disease. Diabetes mellitus provokes structure and functional disorders of the myocardium at the level of the microcirculatory channels. Diabetes is manifested by low-grade chronic inflammation and leads to the development of diabetic cardiomyopathy. Heart damage in diabetic cardiomyopathy is characterized by damage of the microcirculation and ischemia even without critical atherosclerotic obstruction. Also, hyperglycemia enhances the activation of the atherosclerotic process in blood vessels. The mechanism of damage is increasingly recognized as a significant factor in the increase in mortality, myocardial infarction, and heart failure with preserved ejection fraction. Diabetes mellitus has profound effect on both the kidney and blood vessels, leading to significant health complications like chronic kidney diseases, diabetic retinopathy that leads to blindness, and kidney dialysis. Also, diabetes mellitus causes nerve damage due to inadequate blood flow and high blood sugar, affecting various bodily functions.
Yes, so the complications of diabetes could be terrible. The burden of type 2 diabetes is immense, both for individuals and healthcare systems. So, what are the primary risk factors for the development of diabetes, Dr. Olga?
Well, there are several risk factors for type 2 diabetes. The most significant ones include being overweight or obese, especially with excess abdominal fat, a sedentary lifestyle, poor diet, high in processed foods and sugars, and a family history of diabetes. Additionally, certain ethnic groups, like as people of South Asia, African, Caribbean, or Middle Eastern descent, have a high risk of developing the disease.
All right, Dr. Olga. So, and now, could you please explain to our viewers how we can determine whether someone has diabetes? What are the principal signs or symptoms?
Well, the person may experience such symptoms like increased thirst, frequent urination, increased hunger, fatigue, blurred vision. People with slow healing source should consider doing diagnostic for diabetes. Tingling or numbness in hand or feet may be a sign of diabetic neuropathy. Darkened skin can be also a sign of disease.
Thank you, Dr. Olga. Let's now discuss how we can confirm diabetes diagnosis. What diagnostic instruments or quantitative methods are available for diagnosing diabetes?
The following lab tests are essential for diagnosis diabetes and monitoring its management, like fasting plasma glucose, oral glucose tolerance test, hemoglobin A1C, random plasma glucose test, C-peptide test, and urine test. Your reliable medical professional will come up with a list of lab tests required for every individual.
Yeah, you're so right. And how, therefore, Dr. Olga, can DAM diabetes mellitus can be controlled or treated?
Management of type 2 diabetes primarily revolves around the lifestyle modification, which includes a healthy diet, regular physical activity, and weight loss. They are the cornerstone of the diabetes management. In addition to lifestyle changes, medication may be necessary. First-line treatment typically includes metformin, which help improve insulin sensitivity and lower glucose production in the liver. Other classes of medication may be added based on individual patient needs, including glucagon-like peptide first, dipeptidyl peptidase 4 inhibitors, sodium glucose transporter 2 inhibitors, and so. So, Dr. V, let's change gear a bit.
All right.
What are the approaches in bioregenerative medicine to management the diabetes mellitus?
Well, yes. Beyond conventional treatments, there is growing interest in certain non-conventional approaches, especially in the realm of biological regenerative medicine. Indeed, regenerative medicine holds promise for the future of diabetes treatment. Stem cell therapy, for example, is being researched for its potential to regenerate pancreatic beta cells, which are responsible for insulin production. At the same time, the targeted organ-specific implantation can help to fight against the complications of diabetes type 2 in other organs than pancreas, like brain, eyes, etc. Similarly, the use of peptides to improve cellular function and metabolism could complement traditional therapies or stem cell therapy, helping to stabilize blood sugar levels and improve overall health. Mitochondrial peptides have gained a lot of popularity and attention nowadays due to their potent therapeutic effects on different kinds of diseases, including diabetes type 2 and related metabolic disorders. Another wonderful product that we have in our range that acts as an analog for glucagon-like peptide is glycemic normalizing peptide type 1. It has been studied for its potential effects on glucose metabolism and weight management and anti-inflammatory action as well. And we shouldn't forget about supplements, of course, that support metabolic health. Some supplements, well, like omega-3s, are designed to improve insulin sensitivity, reduce inflammation, and support cardiovascular health as well, that are key areas for concern for people with diabetes. Also, we can advise to our patients such supplements like MF3 Swiss Natural Glucose Management that contains epicatechin-gallate and berberine that have shown great benefits in regulation of blood sugar and HB1AC. As a part of the multimodal approach that we have in the W, the patients may also benefit from the therapeutic action of different devices. For an instance, like hyperbaric chamber, as an increased oxygen delivery is especially good for those patients, for those people who have diabetic foot ulcers and diabetic neuropathy.
Absolutely. It is essential to approach diabetes management holistically, considering both conventional and innovative therapies. But as always, this treatment should be discussed with a healthcare provider to tailor the approach to each individual's needs.
I agree. And beyond treatment, prevention is equally crucial. Focusing on a healthy lifestyle as primary care provider must encourage all people with diabetes to stop smoking and refrain from drinking alcohol, maintaining a balanced diet, staying active, and keeping a healthy weight. So this is the best defenses against type 2 diabetes. Additionally, regular screening is vital, especially for those with risk factors, as early detection can lead, for sure, to better outcomes. And the persons that are older, that 40 years of age should be screened annually.
Prevention is key, and for those already diagnosed, managing the condition effectively is crucial to prevent complication. The complications of diabetes mellitus are life-threatening and seriously diminish the quality of life. Early intervention and a comprehensive management plan can make a significant difference in the quality of life for people with diabetes.
To summarize, type 2 diabetes mellitus is a serious but manageable condition. With the right combination of lifestyle changes, medical treatment, and regenerative therapies, individuals can live healthy, fulfilling lives. But once again, early intervention, early treatment and prevention is crucial.
Exactly. Thanks everyone for joining us today. If you found this video helpful, please like, share and subscribe. And please don't forget to ask us any questions.
See you next time and please stay healthy.
See you.
See you, bye-bye.